Cats are incredibly fun to play with, and every day they show us that they are smart animals. Nevertheless, as many other living beings, cats get sick sometimes. Hi, my name is Nur Shaira, and I will share with you about dangerous cat disease. According to the Human Society of the United States, there are more than 70 million feral and stray cats roaming the streets. Because stray cats often carry dangerous disease, the best thing that you can do to protect your domestic cat against serious illness is to keep it indoors. By staying inside, your cat is less likely to fight with other animals and risk the chance of spreading disease through worms. You will also keep it away from infection-spreading parasites, including fleas and ticks, and prevent the kidney failure that can come as a result of ingesting poisonous substances such as antifreeze. Outdoor cats and those that live in multi-cat homes have the highest risk of disease. However, it is important to know that indoor cats and only cats can get sick too. The good news about cat illness is that most are easily preventable, while the bad news is that once your cat contracts an illness, it can be very difficult to treat. It's also important to keep in mind that even minor ailments can suggest major health problems. Like any living being, cat can suffer from a number of various pathologies, some more serious than others. Extensive research on the sudden death of cats has found evidence of the causes of the cats getting a dangerous disease. Feline leukemia is a disease that spreads through urine, nose discharge, and saliva. Cats can catch the disease through bites, sharing food and water bowl, and from simply living together. Apart from this, mother cats also can pass the disease along to their kittens, and kittens are more likely to contract the disease than adult cats. Furthermore, renal failure, which occurs by kidney disease, is one of the leading causes of death in older cats. Causes of kidney disease include age, genetics, and environmental factors such as ingesting poisonous substances. Renal failure in cats can take two forms, which are acute and chronic. Acute renal failure is associated with a sudden stop of kidney function, while chronic renal failure results from a progressive deterioration of kidney function. As we can see from this cat disease chart from 2010 to 2015, kidney disease is the third with highest number of cats. Cat's kidney can begin to fail with age. Untreated, kidney disease can lead to a serious health problems. When it's chronic, there's no cure. But with early diagnosis and good care, you can help boost both the quality and length of your pet's life. Besides, according to the Merck Veterinary Manual, cats are reported rabid more often than any other domestic animal in the United States. And feline rabies is one of the most dangerous cat disease. This is because it doesn't infect just cats, but it can be passed along to humans too. Rather than cat-to-cat transmission, feline rabies usually spreads to cats through bites from wild animals. The debilitating and degenerative disease attacks the nervous system. Now that all of us had known about the causes of cat disease, let's take a look on the effect of those diseases to the cats. Some cats will immediately become ill upon contracting the virus. However, in other cats, symptoms of the disease will not manifest for several weeks. Feline leukemia can result in a number of conditions, including system-wide infections, diarrhea, skin infections, eye disease, respiratory tract infections, bladder infections, infertility, anemia, and cancer. Any severe chronic illness can be a sign of feline leukemia. On the other hand, a number of symptoms can show up as a result of kidney disease, including excessive urination, increased thirst, nausea, a grinding or cracking sound in the jaw, vomiting, dehydration, constipation, loss of appetite, weight loss, halitosis, which is ammonia smell, and also lethargy. If your cat is experiencing any of these symptoms, your vet can test for kidney disease and renal failure. Urinalysis can test to see if the cat's urine is diluted, which indicates that its kidneys are not passing waste. Blood tests can check on creatinine and BUN, which is blood urea nitrogen levels. And elevated creatinine levels can be a sign of loss of kidney function. Alright, moving on to the next effect. Failing rabies can be deceptively slow-moving. The disease can incubate in cat's system for as many as 2 to 5 weeks, according to birdinfo.com. Symptoms include poor coordination, conjunctivitis, yawning, drooling, fever, strange behavior, depression, and weight loss. Now that all of you are more informed about this dangerous disease, their causes, and also effects. So for the conclusion, regular health checkups, including blood tests, is important. When your cat is over the age of 6 years, regular wellness checkups are mandatory. When you notice that your cat acts strange or is weak, it is likely a disease has developed already. Along with the health checkup, always pay attention to your cat's condition and behavior. This way, you will be able to detect symptoms as early as possible and you can prevent or treat illness.